What's up, guys? So, we're back with another video. So, what I wanted to talk about today was what's obviously on a lot of our minds is when is this coronavirus going to be over? So, we all know since at least the United States, um, March 11th is the day I like to point to as the first official day that we had coronavirus kind of shut things down, which started with like the NBA and like Rudy Gobert. Um, but I think the first official death was actually, I want to say December 2019 or maybe November 2019. But regardless, we've obviously been in this situation for the decent majority of a year now. And I just wanted to see like what's going on, what's going on with the coronavirus and the vaccine rollout, and how are we gonna get out of this mess that I've definitely not liked the situation that we're in, just the impact it's had on my life and the impact it's had on a lot of our lives, whether it be physically, obviously, people dying, about 450,000 plus now, mentally, people's mental healths, the isolation they feel, the remoteness that people have had to be in due to the pandemic. Um, and then also, as well, we have the economic aspect of it. People not being able to afford different things in terms of their rents, their mortgages, food, um, and things all across that nature in the economic spectrum, while we still have hedge fund managers and billionaires and Wall Street people running out the back door with all the money that they got. But just to talk about some things here that I've like noticed. So like in terms of what we're doing specifically with coronavirus, looking at America in particular, obviously we've had this vaccine come out. We've had Moderna, or however you say it, Moderna. I'm not sure how you say that, and Pfizer vaccine come out, and that's been one that we've been using. I know Oxford's had one as well, and I think there's one other company or two other companies that I'm not sure, but those are the two main ones that I know I've looked at that have had vaccines come out that we've been trying to use and distribute. And the distribution process has just been anything, everything short of what it should have been. It's been quite frankly abysmal. We wanted to get about 20 million, was what Fauci was saying. By some point, I think a couple months ago, and we just haven't been able to get to those levels that we needed to. Some of the states across the country, I think it's like 33% of the delivered vaccines has been administered now and has been put in arms, which is just crazy to think. Like we have the ability to create we have the scientific knowledge and the human intellect in order to create a cure effectively to this vaccine. Yet the simple task of just what we've done all the hard work into making it and just administering it, we've completely botched that, and we made it put ourselves in a situation where we're really struggling to get rid of this vaccine. So we've had cases where different states and different counties have different laws in the way they administer things in terms of the age range they can get it, who gets it first, who's in the first wave, second wave. And it seemed to be that some of those in a lot of the places have been way too restrictive in the ability to get vaccines into people's arms. So they've tried to open it up, just because of the restrictive nature that it's caused, where you have some people not being able to get it. You have people not being able to get it who otherwise should be able to get it. And instead of those vaccines being used, they're just sitting in the storage lot or the storage compartment in the pharmacy, and they're not getting used. And before you know it, they go bad, and you don't even get to use them because we have too much a limit. But then you also have the other case where people who may be working with those healthcare workers who have access to the vaccines are skipping the line, getting ahead, and it makes the situation where people who shouldn't be getting it get it. So like obviously we wanted to make sure that people who need it first get it, but the restrictions and depending on the different areas, the different states you're in, can make this kind of complex and complicated, like we have in the situation. I truly believe that with the amount of people we have in business and supply chain and operations, and in healthcare who go through these operational tasks of administering drugs and vaccines and medicines to people we should have it pretty down packed, and which is why I make the plug for Medicare for all. Medicare for all, having a top-down national healthcare system would really standardize the system when you have something like this, a pandemic breakout where you're administering a vaccine, because it would be run the same way from the federal level, state by state, localities would all run it the same way, and it would be much more effective than having different rules and different regulations on how things are administered in different places. So once again, Medicare for all, especially at a time like this, time of health crisis, would be the answer, at least in my opinion, that we should go with, in order the next time we have something like this that occurs, because scientists have said there's more likely that this may happen again in whatever how many years it does happen. Having a national healthcare system would greatly benefit a country like America. And while some people may argue, like, oh, other countries have a national healthcare system, yeah, we still have the most amount of deaths, the most amount of cases. So you may say, oh, the other countries may not be doing as well. I agree. Some countries may not be doing as well. They're definitely doing better, though. Definitely doing better. Numbers don't disprove that. So, and for America, countries rich as us with the resources that we have and the intellectual people that we have in these sectors to make sure we get a vaccine distributed equitably and correctly, it's a shame that we haven't been able to do what we've been able to do. So, in terms of when, how it's going, that's what I see. And so, in order for us to really just get out of the situation, what people need to be doing is double masking. I think the effectiveness of double masking is 96.5%. Still stay at home. Still just try and only limit yourself to things that you need to do, and really stay vigilant, because we're definitely taking a dip down into the second, what should I say, the end of the second wave or third wave, however you classify it. But we're definitely getting to the tail end of a wave, which I think if we continue to stay vigilant, the vaccines, as we get to know more and more, especially with these new variants coming out, and the medical companies start to understand how they can use their vaccines to target those ones, we'll be able to put ourselves in a position where we're really looking at the tail end of this pandemic come the end of 2021, heading into 2022. Um, so yeah, you see some of these states here that have been more successful in some of the things they've done. So actually, my home state of Connecticut is at a good 60.37% of the doses have been administered. And you also see South Dakota, North Dakota, and West Virginia here. So some of the smaller states, which we thought would maybe have difficulty just being in more rural areas, there's a lot of ruralness where I come from in Connecticut, have actually been better at distributing this, just based on what they've been able to do and some of the things that the practice that they employed, whether it's using their CVS and Walgreens or using their small medical pharmaceutical companies in order to distribute the vaccine. So I applaud some of these smaller states that have done a good job in the 60s and 70% of administering their vaccines. I think those numbers are still relatively low and should be. I don't see why it can't be something that's 90%, 95%. You get the vaccine, you should have people in line in order to take them right away. And I think that the fact that we have some states in the lower 20s, in the 30s, in terms of their administration rate to distributed rate, is really abysmal. And I really don't understand why, as a country, we allow the situation to get like this. And you can see here some of the states that I've linked, percentage of their vaccines that have been administered. So you can see here, we'll just scroll through some of these states, and it's just low. You see a lot of things under 50%. A lot of things under 50%. It's very discouraging numbers to see, just based off, I guess I may be a little bit naive, but I just have more faith in Americans and their ability to do such things. Like, I just think that the hard part is creating the vaccine, the easy part is administering it. I may be naive in that analysis on my part, just because some people may disagree and say that, no, it is pretty hard getting these things. I just think that when you have the ability to create something with the science that we've been able to create, and create these at such an effective rate and such a quick rate, in like about a year or so, administering it should be the least of the worries, and it's showcased to be the most of our worries right now. And you see Dr. Fauci and some of these experts talk and slam the way that it all did start with Trump and his handling of it initially, and then into how he handled the rollout while he left office. He really did try to leave Biden a mess, which is unfortunate, because you're not playing with just political things, you're playing with people's lives. So hopefully Joe Biden and his administration, they're trying to take a very firm grip on what's occurring, but they're really trying to showcase that they're trying to take this seriously and get us out of this as quickly as possible. And I applaud them for putting the efforts that they need to make sure that we can eradicate this virus in due time. So just to end, when I think this will end, this is a lot of just conjecture based on some trends and how we look at it. We continue to mask and we continue to only do essential things. Um, I think by the end of the summertime, once we get a vast majority of the people in our country vaccinated, we will see a significant decrease in cases and deaths and hospitalizations. I think once we get into summer period, yes, but also going into summer period as things go down, if people start to become lax in their ways and start to become more, oh, it's almost over, then we may see another uptick and it will bring us back to a point where we may not just be looking to end of 2021. We may be looking this time again, January, February 2022, where we're in the same situation and we are starting to get things down again and the summer is starting to open up. So it really just depends on the people and their will, and obviously some of the political impetus of the people administering these vaccines and how they deem that fit. Yeah, and just to end, so like we have Israel here, they're about 75% vaccination rate by April of this year. U.S. should get there by the end of 2021. Some of the less developed countries, obviously, I think the reasoning they may be a little bit behind is one, they do have a lot of less countries, especially in some areas in South Africa, in the Asias, and South America, in the Asias and the African countries, have a numerous amount of less cases, so their timeline to get the vaccine may be delayed. But we want to make sure that they do get them in due course. But obviously, the places in the westernized world that has been hit harder with the coronavirus, we'll see them get the vaccines earlier, which is the case. And hopefully, we can get to a point where by the end of this 2021, I think if we stay vigilant, and when I say we, what I mean by that is the people who, like myself, and the people around me who have continued to mask up and continue to only go out for essential things and continue not to gather with people who are outside their bubble, if they stay doing what they have been doing, then this will, by the end of the summer, going into Thanksgiving, Christmas time 2021, we should see it mostly on a very slow decline and almost back to normal by the start of 2022. But if people like us who haven't been who have been vigilant start to veer off from how they have been approaching the virus, I think we will see that because we already have the half the country Trump people who really don't care and are very individualistic and don't realize the effects they have when they don't mask up and they continue to go out, they're not going to change for the better. So us 50% or 60%, however percentage it is, who are masking up, staying vigilant, continue to do that the rest of 2021. And I think by the end of 2021, we'll get to a point where masks are no longer necessary. The vaccine is administered at a rate where deaths are hopefully at zero. Cases are hopefully in the less than thousands, maybe just in the hundreds. Hospitalizations due to COVID are non-existent. I think we can get there by the end of 2021. It all just depends on the three things. If we can really stay masked up, stay inside, people be vigilant, stay vigilant. The people who are administering the vaccines and their technical expertise when it comes to operations and handling and supply chain, figure out better methods of regulations of who this should be applied to, when it should be applied to, and how they can administer it at an effective rate. Do a better job in that course under the guidelines of Dr. Fauci and those health administrators. And then also, like I said, just making sure that we continue to do the things that we need to do as a country, and do not steer away from what has gotten to this point where we're in decline from the second wave. So, yeah, hopefully we all really do wish that this coronavirus pandemic goes away in very short order. And the only way we're going to get there is by staying vigilant, getting these vaccines rolled out in a correct way, and making sure that we see this through. So 2019, 2020 and 2021. 2021 is going to be more of a twin to 2020 than it is 2019. And if we want to make 2022 more of a twin to 2019, then we have to make sure that we stay vigilant in 2021 throughout the rest of this year. So that's just my call to action for anyone watching this. Thank you for watching. Really appreciate the support. And I'll see you guys in the next video very shortly. Take care, guys.